a basic thing which anyone can do, anyone should do in time of emergencies or when there is a problem. So now we are going to discuss what is first aid. What are the measures which as a layperson we can oversee or look into. Those things are done to the sick patient. So what is first aid? First aid is the first assistance. The treatment given to any sick person when there is a sudden illness or until the ambulance is arrived. That's the basic meaning. So what is the aims of first aid? First, to prevent the deterioration of the patient further and to preserve life. So these are the main aims in the first aid. So just like simple manners, when discussing BLS, we have seen just like chin lift, neck lift and chin lift, the patient can breathe properly by preventing the lung falls. So this prevents the hypoxia, that means patient dying with lack of oxygen. That can be prevented. These are some of the manuals which will come out in the first aid. So these are the standard precautions which you have to take, because we have come across pandemic in COVID era, that we have to see ourselves first, then we should treat the patients or any sick patient. Use the barrier devices as much as possible, gloves or even mask if it is available. So your safety is the primemost thing which you have to look after when rescuing any sick patient. And it's better to, that's what it is. To wear the gloves and dispose the glove. Picture is self-explanatory, I will not explain. So as I was discussing how to approach a sick patient, first your safety is most important. See, while giving a CPR, you can't give CPR at the middle of the road. You have to shift the patient to somewhere else where the patient and yourself will be safe enough for you. That's what seems survey, primary survey is the first thing. And in emergency, we have to look for airway, breathing, circulation, disability and exposure. As it was already discussed in BLS, you have to open up the airway by head tilt and chin lift. And you have to make sure the patient on the supine position on any hard surface. So call for help. The ambulance services, you know about it, and the universal emergency number is 112. It is recently done. 112 will streamline the calls to fire or like that. These are the secondary survey. Usually it is done in the hospital setup. We don't go through that. This is how you have to check for the responsiveness. Tap out the shoulder and if you know his or her name, call out his name, or otherwise you scream so that even sedated patient or even sleeping patient can wake up. And here it is 112, not 911. And you have to open the airway. This is head tilt and chin lift procedure. So you have to extend the neck, like just like a sniffing position. The way you sniff around some object, just like that you tilt the head and you have to lift the chin. This is the way of lifting the chin. And you have to check for breathing for 10 seconds. So whether the patient is breathing or not, you have to check for 10 seconds. And you have to check for pulse together also here. The same way is it's holds good for child and even infant. But here the difference will be you shouldn't tap the shoulder for the children or infant because their skeleton are poorly developed, so you have to tap the foot. And checking for the pulse, carotid pulsations are not required. Here, brachial pulsation, because the neck will be short in children. You have to check for the brachial. I think mid-arc position, you can check the brachial pulsations. And the rest all things remain the same. These are the things you have to look for: airway, breathing, circulation. Circulation means checking for the pulse. Positioning of the patient, universally it has to be supine position on the hard surface. So this is how an injured person can be taken care of if the patient is conscious and limping. You can support yourself, or you can ask for help, and you can carry the patient like this or like this. This is when you are alone. This is the way you have to shift the patient. See, one thing you can make out is here there is no displacement of the head. It's like he is not picking up the head. Cervical injuries are more common in RTAs. So you shouldn't displace the head. You should just move like in this dragging way, or with the protective covering, or like this also. Because cervical injuries are more dreaded things, it causes respiratory depression and immediate arrest. Whatever the resuscitative measures you take, it won't be of any benefit to the patient once there is a cervical injury. So, if the patient is having, like you can come across in your daily life, patient might having convulsions. Like Layton's terminology, let's say fits. So if the patient is having the convulsions, then this is the position which you have to follow. Flex at the elbow and keep it at the opposite side of the ear and rotate that as a pillow. You make his own hand as the pillow for himself. And you just turn around to that side, so that this is the position, recovery position. This is called as recovery position, where the patient himself won't harm himself while in convulsions. They terms terminology fits. They can have the tongue bite. So while seizing, they tend to bite their own tongue. So to prevent that and to prevent the aspiration, you need to follow these steps, and this is called as recovery position. So any patients are attempting for suicidal ingestion of poisons, you might encounter. So conscious patient, there's not much of things to do in the light attendance means like those symptoms. So these are some of the symptoms. This is just a pictorial depiction of how they can have the symptoms. So usually you have seen in gymnastics, the patient is having acute chest pain. That's because they are not accustomed to those things from lower to higher. Just out of the blue, they will go 6th month or 1 year. They just go for vigorous training. That's what is one of the contributing factors for young minds. So whenever whenever any person presents with chest pain, usually in home they will have aspirin 300 mg. You just ask them to chew 300 mg of aspirin, and you have to make the patient lie down in a comfortable position and shift the patient to nearest medical center for further help. So what is stroke? Stroke, partial. What is that? It is a deficit or else pathophysiologically Some part of the brain is not supplied with essential oxygen and metabolites. There is an obstruction which will impair the functioning of one side of the body. So this is called as stroke. The symptoms of stroke is the patient can have swelling of speech, difficulty in speaking, or difficulty in moving around, or deficit in the one side of the body. He is not able to lift the limb, upper limb or lower limb. These are some of the symptoms of stroke. There is something called as window period in stroke. So that is 4.5 hours. Within that time, the patient needs to be shifted to hospital, because there are two types of stroke. One is hemorrhagic stroke and ischemic stroke. Hemorrhagic means the blood will be leaking inside the brain. Another one is there is a block in the vessels which are supplying to the brain. So we can't diagnose clinically or bare-sided which type of stroke it is. So the patient has to undergo CT scan. Available in the market. BLS 650 is prevalent because of the COVID era. Every household will have BLS 650. Take one tablet of BLS 650, you know how taking one BLS 650, and you have to seek medical attention, because you can't differentiate it with bacterial and viral fever. Bacterial fever requires antibiotics, viral fever doesn't require antibiotics. So, the patient fainting. We need to know how to relieve choking in adults as well as in children, because foreign body injection is more common in children rather than in adults. I need a volunteer train himself or herself how to relieve the choking. So this is the universal sign which they can have whenever there is choking. So he is having a choking like symptom. He is gagging for breath. The other person has to go behind and make a fist in the one hand and cover it with the other hand, and just at the level of the referred sternum, that is you can feel the soft and hard part between that area. You can feel yourself in that area. You have to hold this one, and it should be upward and backward thrust. The thrust should be upward and backward, so that the intrathoracic pressure increases. When the pressure increases, he tries to expel the foreign body. So this is the way. So at least 3 times you have to. For children, I need a child volunteer. If cooperative, how to do and it's further. So this is in the pregnant woman. You can't do abdominal thrust. So the chest thrust at the site of where you have given compressions, that is the site which you can give the pressure. Then you can follow this. Take down a chair and compress yourself. The same procedure. It's very difficult to follow this, but this will be easier when they are alone and they feel choking feeling. Dog bite, cat bite, snake bite. What? Snake bite. Then someone said snake bite. Snake bite. Okay. So each bites have different approaches. Cat, dog, rat. They are mammals. They have to be treated with rabies immunization. So injections has to be given. 5 doses of injections has to be given, depending upon the degree of bites. Something called as scorpion stings is also there. Snake bite, honeybee bites are there. Very good. So these has to be treated in separate line of management. Snake bite has to be given anti-snake venom. So immediate hospital shifting and transfusion of anti-snake venom has to be given, and even anti-scorpion venom is also there. So that thing. And these things you have one
One thing I would like to mention, what is like regarding chemical injuries you mentioned, accident, words, that's fine. But when you have penetrating or perforating injuries, something penetrates the eye, or something like bull bore injury, it might perforate the eyeball. Okay, then what you will do? You're not supposed to do anything, right? No pressure on the eye. That is very important. Okay, just cover superficially and immediately reach either an eye hospital or ophthalmologist, not elsewhere. Okay, that is what you are supposed to do. So thank you all for participating for today's program.
Thank you.
And I hope all of you learned a lot, enjoyed the sessions also. Thank you. ನಾನು ಡಾಕ್ಟರ್ ಶಾಂತನಾ, basically an ophthalmologist. I'm working as Professor Department of Ophthalmology, Bapuji Kannin Aspathri, and also I'm a core committee member of SSK.
Actually, it was a great opportunity for Mission is Davanagere. So now here we are going to response.
From SSK testing, when we formed, and Madam Dr. Prabha Mallikarjun, she is the main person here. Okay, now she wants to conduct many activities. In fact, it is not just the BLS program. I mean, she wants youngsters to learn and have knowledge about how to act in emergencies. So, we are conducting not only for even limb batch for all colleges, schools. I mean, police road group every 30% batch. We are conducting, and this is an ongoing program. It's not just one dina madli, other dina madli. It's just ongoing program, so that everybody is educated.